Before you begin your finger splint, determine the fracture or injury location and gather the material you will need. Depending on the location and type of injury, you will need a specific finger splint. The following materials are used for finger splints: 1/2 inch aluminum foam, 1 inch aluminum foam, finger stacks, 1/2 inch tape, Coban, and scissors. There are many different types of finger splints that you may use. However, there are 4 main types that are most commonly used. There is buddy taping, aluminum foam finger splints, which the first two may be combined, alternate finger splints, and then finger stacks. Type A is combined with buddy taping and aluminum foam finger splint. This is most commonly used for minor finger sprains, phalanx fractures from the tip to the MCPs, after laceration of repair, or after tendon repair. You will need 2 pieces of 1/2 inch tape about 4 inches in length, 2 pieces of 1/2 inch tape about 8 inches in length, and size a piece of aluminum foam from the tip of the finger to the MCP. Now you might have somebody with a simple non-displaced fracture, or maybe they have a jammed finger and you want to do buddy tape, but you want to add some aluminum foam to it. So what you can do is apply the aluminum foam splint to the length you need of the finger. What I do is lock that down first. I have 2 smaller pieces of tape and then the 2 longer pieces of tape. Once you applied the 2 smaller pieces and you have the aluminum foam locked down, you can buddy tape it next to another finger. This is a finger splint with buddy tape. Make sure you get the 1/4 inch tape because it applies easier. And that is it. Type B is an aluminum foam finger splint if you need to provide more stability for a fracture or an injury around the MCP to the DIP. You will need to measure a piece of aluminum foam to the volar aspect of the MCP around the tip of the phalanx and down to the dorsal aspect of the base of the phalanx. Then cut the Coban to make it easily applicable around the phalanx. Now if you have a patient that has a finger fracture in between the DIP and the PIP or the MP, what you can do is apply a longer finger splint and make it go down dorsal side of the hand. Again, this is aluminum foam and you just cut it down to size. And same thing as our other splints, you just go around the hand doing a triangle. Usually I do around twice. And that is it. Type C is an alternate finger splint to the finger stack splint. If a patient has a dressing applied, this splint may be preferable. This is used for injuries to the DIP joint, which may be used to hyperextend the joint. You will need to measure a piece of aluminum foam from the volar aspect of the PIP around the tip of the phalanx and just past the DIP joint. Cut the Coban to make it easier and more pliable around the phalanx. Alright. If you have a patient that has a bandage on their finger and you can't slide a finger stack splint on there, what you can do is use aluminum foam and just apply it over the finger. And notice this goes over the tuft of the finger or the nail bed. And you apply it the same way. Stretch out the Coban and then go around the hand. do a triangle. And that's all you need. Type D is the finger stack splint. This type is used for mallet finger or fractures involving the tip of the phalanx. You will need to correctly size the patient's finger to the needed stack splint and cut the co-band to make it more easily applicable around the phalanx. Once you size it to a patient, you want to slip it on. And then what I've done is take some co-band, and it's about 1 inch size, and go around the finger. Now, co-band can be restricting, so just stretch it out a little bit before you apply it to the patient. Now, if you leave it right here and just cut it off, what will happen is it will probably slip right off the patient. So what we do usually is go around the hand. You can go either around the wrist or the hand. Basically, you're making a triangle. And that is it. This is the conclusion of this video, and thank you for your time.